What I want to do is lay the kind of the foundation for how this process went about, and really not only where we have been, but where we are, and then also where we are going. So if you've been on one of our roundtable discussions before, you will hear me constantly say, and all of our team at Ellerbrock-Norris say, that we speak to business leaders around not just Nebraska, but throughout the country quite often. And to almost the company, when we ask them what their end goals are, we can really boil it down to one of two things. They want to reduce and or better manage their costs, and they want to provide better benefits to their employees. And a lot of times we think that means shopping insurance companies. I believe that insurance can be the largest barrier to healthcare and the largest creator of costs because of the administrative overhead and the number of hands in the cookie jar. We sat out on this journey with Eric in alignment with the hospital to say, how can we improve the healthcare access to our community while simultaneously creating a platform that puts the employer, Mary Lanning, on the same page. And that's what we've done. You, as an employer, must understand where your costs are coming from so that you, in turn, can better manage your healthcare supply chain. Now, if we break down the vast majority of costs in the United States, they are comprised about 90% of them by 10% of the population. So 90% of all costs are typically generated by 10% of the population. How do we solve for the healthcare challenges that we have? We really need to solve for 10%. And that's going to yield a big return. And that really comes to what we call the managing the frequency and severity of claims. A massive piece to this puzzle that we have built out with Mary Lanning is an engagement. We oftentimes refer to healthcare, sadly, in our society as the milk in the back of the grocery store, in that we have made it more difficult for employees to access care, for members to get care. And that MRI that doesn't get received, that physical therapy that isn't received, that diabetic that isn't properly managed, that becomes later a catastrophic claim, and that's what spirals our healthcare system out of control. So when we launched this platform, it was with the idea that we would secure the best contracts, the best in pricing, the best in access and engagement and data analytics and data for you to roll out. And I'm pleased that we've done that.